It has the list of all of the meetings.
Oh.
How are you?
Good, how are you? History of my life, history of Africa.
Is it right?
All right, guys, we're getting ready to start. Make sure you sign in the chat box if you are on Zoom so that we know who's here.
Oh, this is a hybrid vehicle. Cool. I've always wanted to try that with cruise therapy. Okay.
All right, you should have seen an agenda in the calendar invite that I sent out. So every month I will put the documents in there so that you can see them. We are gonna go ahead and start. Welcome, happy 2025. It's been a whole year since I've seen you guys. Or at least it feels like it. Apparently everybody decided to stay home and enjoy the snow day because we are lacking in people in here, but welcome those of you who braved the snow.
There's only 6 of us.
Is the hot stuff down today?
No. We just did a delay.
All right, 12:01, I'm gonna go ahead and call this meeting to order. Again, please make sure you sign in on the chat or sign in on the back wall. If I could get somebody to, the minutes are from November are in your packet. Give you a few minutes to go over that. And then I'll entertain a motion. And just a heads up before you talk, because on Zoom, I don't know who you are. State your name prior to speaking. So that way the note taker will pick it up and then I also will know who you are.
I'll put a motion to approve.
All right, Emily, motion to approve the minutes is written. Sonia seconded. Any corrections, anybody else? All right, being none, we'll move on. Is Rick online?
Yes, I am.
All right, now it's time for the treasurer's report.
So, at the end of December, we finished off with $158,684.48. The breakdown for that is the Health Council has $89,558.12. The Expo has $17,709.33. And together with veterans has $51,417.03.
Does anybody have any questions for Rick? All right, thank you, Rick. New business. Is anybody from CYFD online? Didn't respond to my text. Or my message, my voicemail.
Do you want me to talk about it?
Do you want to talk about
Or
it?
do you want to wait until?
Event?
Appreciation dinner. Did you?
All right, since CYFD is not here to discuss their sponsorship request form, we'll go ahead and hold it off till next month and see if we can get them to respond. So we'll postpone that one.
We should have.
Who usually attends from CYFD?
Nobody usually. But it was,
Jennifer Gordon, who put in the request for the funding. Because we're partnering with them to do a foster parent appreciation dinner in June. And they don't get funding. Yeah. To do anything. Right, yeah. How do they don't get funding, how do they? They have to get donation.
Okay, moving on, so health council activities. Right now we have a total of 72 members. We increased one. Welcome Kenya, which I think is just a renewal from before, because the name sounds familiar. Maybe, maybe not. I don't know, but welcome Kenya, if you're here. Update on the Behavioral Health Leadership Council. They have not had a meeting yet. I think one is scheduled for next week. So
Wednesday.
yeah, so we'll keep you updated and we'll let you know what happens next month with it. The FY25 Health Council activity updates, the youth education and awareness and the food insecurity. As far as I know, nobody else has had any meetings on those. Is there anybody online?
I know that Diane's been out. Correct.
Okay,
I don't think so.
so we have no updates on that one. In your packets, you will see the director and the behavior, Emily's reports. We put in November and December in here. It's been kind of slow for a lot of things, just because holidays, and of course, the flood affected a lot in November. But we'll let you guys go through that. Let me know if you have any questions on any of it. Danny did submit a December one. I just didn't have time to put it together for her. And the packet was already done, so again, not a whole lot going on. We are working on the symposium planning for Together with Veterans. And that's kind of it on that one.
If anyone wants to sponsor the Veteran Symposium, we could, Carrie will send out a sponsorship vendor form for that.
Yeah, we have a meeting on Saturday. I'm hoping all the forms will get approved there. And then from that, starting Monday, I'll start sending stuff out for sponsors and various things for that. Anybody have any questions? I feel like this meeting is going to be done in like 2 minutes. All right,
Everybody will have to-
I know everybody's gonna, yeah. The 211 numbers are below. I changed that a little bit because I didn't think the numbers, it was kind of hard to know what we were truly doing. So now you're gonna see it at a glance. And you'll notice October, November's numbers are huge, and then we start dropping back down again. If you ignore the disaster piece of it, if you look at what most people are looking for, it's utility assistance, rent assistance, housing. So our normal stuff, and they just keep climbing.
Massachusetts.
Any questions on 211? You guys are awfully quiet.
Really sweet.
All right, so now that puts us into the individual updates since time does allow.
Sure. I don't know if we can squeeze that in. I know.
We'll go ahead and start with those on Zoom.
Should I stop sharing so they can see?
Yeah.
We'll start with Joanne Palomino.
Hello, everybody. In the chat, I went and posted the road to recovery flyer and vendor form. So if any of you are interested, just follow the directions and send it in. And then please share the flyer, and hope to see you all at the race in 2 weeks.
Yeah, I think so. Hang on just a second.
Who's talking?
Joanne Palomino.
That's Joanne Palomino,
Okay.
QH.
Do the.
Hang on,
Try
give us-
the pluggable audio speakers.
Could you hear me? Do I need to repeat again?
The TVs, is that what
Can you talk again, Joanne?
Yes. Okay, so Joanne Palomino with the Pittsburgh Department of Health. In the chat, I posted the road to recover flyer plus the vendor form.
Okay, hang
And-
on. Technical difficulties, so, we're just gonna do a mic test.
Okay,
Why is it not? All the remotes are right there. By Emily. Oh, okay. You want me to send it?
Is it that you all can't hear correctly? Because online we could hear Joanne.
Yeah, we're trying to connect it to the TVs, instead of
Oh,
the
okay.
album.
Try the speakers pluggable audio again, now that the TVs are turned up.
Can you
someone
talk
talk?
again?
okay, Joanne Palomino with New Mexico Department of Health. And in the chat, I went and put road to recovery flyers for the walk, January 25th, and vendor form. So please get your registrations in, and we hope to see y'all at the race. Dress warm.
Thank you.
Do more,
Eric?
usually over 50.
Eric, do you have an update for us?
I think he's trying to mute himself.
I meet for Renew Health. I know we're planning on attending the health fair. We're really reaching out, trying to get more inside the community and other local counties as well that are kind of connecting to Chavez as well. So everything's going good at Renew Health, and we're just looking forward to the health fair, and hopefully we got a lot of visitors and a lot of support with the public.
Thank you. Lucia?
Yes, ma'am.
Hello, I'm Lucia Tena, also with Road to Recovery. I'm just again promoting the race, promoting our Road to Recovery race. Eric, that would be a great place for you to come out and meet some community members, because we are going to have the vendors out there. It is a lot of fun. You hear testimonials from the people that show up for the race. Like Joanne said, dress warm, but I'm just here again to promote Road to Recovery. Thank you.
Thank you. Joanne Lopez?
Hi all, this is Joanne Lopez. You'll be seeing me out in the community as a community health worker. I'm representing a few various organizations at events and different things, as well as a staff member of Roswell Job Corps Center.
Thank you. Evangelina?
Oh, hello. No, I don't have anything.
Rick?
The new happening at the Boys and Girls Club right now.
Thank you. Carolyn?
Hi, this is Carolyn from Adult Protective Services, and I continue to pass along resources and information to all the caseworkers so they could pass along to their clients. So I really appreciate all those resources that you all provide. And I don't have any updates. Thank you.
Thank you. Regina?
Good afternoon, everyone. Happy New Year. The New Mexico Department of Health, our team, Marisa and I, have our school health update is been rescheduled for March 5th. This was initially scheduled in October, but due to the floods, we had to reschedule. We are looking at a new facility and we'll be meeting at the Artesia Public Schools Administration Building. And so we welcome any vendors who had committed to being vendors at this event. This is the new location and the new time, March 5th. We will be sending more information out. I will send it to you guys here so that it can go out to this listserv. So anybody who wants to be a vendor or who's interested in attending for CEU training hours, feel free to send us information. And that's all I have. Thank you.
Thank you. I lost my spot. Tiffany?
Good afternoon, everybody. So announcement number one, Be Well is open, has open enrollment through the 15th. So if you do not qualify for Medicaid, I highly suggest you go to the BeWellNM.com, I believe, website and do the browse plans, and they'll ask you for some basic information, and then they'll give you a quote on what the different prices are for the different plans. I did it myself, and if I were to only cover myself out of the family of 3, there was actually one that, or a few that were 0 premium. So it was 0 cost. It would be completely subsidized, which I highly suggest anybody who is not insured, please look at this. It's open through the 15th. Having some coverage is better than having no coverage. And also I am looking to do more presentations on what Molina offers. If your organization or company, office, whatever it may be, would like for me to give a presentation on the different services that Molina offers, because although I mainly represent the Medicaid portion, we also have a Medicare and the Marketplace as well. So I put my email in the chat. If you all would like to reach out to me, please do. Thanks.
Thank you. Jessica? Jessica, do you have an update or any announcements you'd like to make? Okay, Nereida?
Hi, no, there's no updates. If you guys are needing help with applying for Be Well, I do help with that as well as applying for Medicaid. Or if you guys have any questions, the deadline is January 15th. I'm already going ahead. And it is true how Tiffany says there are some really low premiums and even copays.
Thank you. Claudia?
Good morning. My name is Claudia. I'm the practice manager for the La Casa School-Based Health Center. I'm just working on trying to get the word out for all RISD students for them to be aware that we are at the high schools and Sierra Middle School for services. If you have any questions, you could reach out to me. We just need a form to be filled out by the parent. If not, we could also get phone consent. And also I work with Nereida with Medicaid and Be Well applications as well. Thank you.
Thank you. Michelle?
Hi, this is Michelle Williams with Toys for Tots. I would like to know if anybody, I've been helping different organizations. I still have a few toys left from the pallets that were donated during the flood, like Encanto dolls, those type of things. If anybody wanted to come and get it to put in their storehouse, that'd be great, because I can't keep them for Toys for Tots because they were supplemental, so we can't stock them. And you can reach out to me and I can meet you. I'm here now with the Homeless Coalition. They're picking up some, and anyone else is welcome. Spread the word, but not spread it on Facebook.
Thank
Thank
I
you.
think we'll come at Casa, Michelle.
Uh-huh.
So I'll get with you and set up something.
Perfect. Perfect. Yeah, we got a lot more. Okay, great. Thank you, guys.
Thank you. Dr. Fraga?
Yes. No updates at this point.
Thank you. Danelia? Gladys?
Hi, my name is Daniela and I work with Molina Medicare. Right now, there's an open enrollment period for those who signed up during AEP and were not happy with the plan that they chose. They're still able to make a plan change. And if anybody's, I am also out in the community as well. You might see me like at farmers markets, harvest ministry, and places like that. If there is anything going on in the community, like health fair wise, I would be interested in wanting to join, and I am going to post my email in the chat.
Thank you. Ruth?
Did you say Ruth Gonzalez?
Yes.
Oh, okay. I'm with Families First, and we are implementing a support group. And thank you for sharing that, Carrie, on our flyer. And it's a group called Bump to Baby Circle, and it's every second Saturday. And the next few months, we're going to be holding the meeting here at the Chavez County Co-op Extension Office at 200 East Chisholm. And it's a group to collaborate with community for new and expecting parents to share with each other, ask any questions, any support, or receive advice. And our topic this coming Saturday is when it is from 10:30 to 12:30. Our speaker will be Raylyn Whitehead, and she's a birthing doula. And so we're trying to get a support group for new moms, families, and dads are welcome to join also.
Thank you. And then we'll start with Sonia.
My name is Sonia Bolaños with Alpha Home Care. There's no updates.
I'm Wendy with Casa Kids Keeping Families Together program, and I don't have any updates.
Jennifer Smith, I do a lot of stuff. So I'm with Casa Kids, with the Family Services in-home services department. For us, we are working on planning a child abuse awareness event for the first Saturday in April. April's Child Abuse Awareness Month. We're still in the beginning stages of that, but we'll be putting out information hopefully pretty soon to get people to come and set up tables and things. It doesn't cost for people to set up tables. You just gotta bring your own stuff. Also working with CYD on their foster parent appreciation dinner that they're gonna do in June. And we're getting prepared to move offices. So we're gonna be up on the 8th floor pretty soon here in our building. So we're excited for that.
Is the refuge at all included in that, or do we have anyone that represents the refuge?
I don't think so.
We don't, I don't think so. It's been a long time, I think, since anybody from the refuge has really liked it. Yeah.
Yeah. So with my Tessa Anderson Suicide Prevention Coalition, we're doing our monthly support group meetings. They're the first Monday of every month. We're there for anything suicide prevention, mental health, somebody just needs to talk. We always on Mondays. What time on Monday? 6:30 to 7:30. And we hold it at the Unity Center. It's at 108 East Bland. And we're available to do QPR trainings for free anywhere that needs it. CPR, QPR, oh, QPR, yeah. And I think that's it.
Thank you.
Hi, my name is Bruce Burleson. I'm a licensed alcohol and drug abuse counselor. Just moved here to Roswell about 9 months ago. Setting up an office over on North Richardson and doing telehealth and pretty much wide open to, I still do telehealth in Massachusetts, but I really want to go local. About the local community here, that's my #1 priority, so I'm glad to be here.
Thank you.
I'm Ann Anderson, Counseling and Consulting, and I'm just busy with a lot of new and old patients, so, and I'm in this building, which is really nice. And I'm kind of new to the health council. I started coming back probably a couple months ago, and I'm still learning the acronyms. What everybody's doing and how I might be able to help with someone. I'm Sarah Johnson with CASA. I'm here with the Family Resource Center. And the Family Resource Center offers assistance for utility, food, clothing, rental, basic needs. We do referrals out into the community. We also do crime victim reformation commission application assistance. So we can help with all of those needs. And we can help anybody in the community, whether they're a family, a single person, someone who's homeless, anybody can come see us, and that's down here on this floor. We continue with our co-location efforts, and we have ALTSD coming on Tuesday. They were here yesterday, and they will continue to be here every Tuesday from 1 to 5. We additionally had Tiffany here in our co-location yesterday, and I think she'll continue to be here on Tuesdays. So you can come and see her here. We have Department of Workforce Solutions here available for anybody on Thursdays, and they're here all day. And we expect to have ECECT here by the 1st of February. We're just trying to iron out their technical needs. Additionally, I'd like to open the invitation for any of you to join us with our resource collaboration meetings. They're currently on Fridays from 12 to about, I don't know, we get done about 1 or 2. It never seems to end exactly at 1. We are in a lot of discussions right now about the long-term recovery group and what that is going to look like for the community. Really trying to put an emphasis on getting all of the federal dollars off the table, all of the state dollars off the table, and then coming in with that recovery group to fill the rest of the needs for the community and really be mindful about the donated dollar. So I would love for you guys to join us for that. We need all kinds of different professionals from all kinds of different walks of life to really be a part of that unmet needs committee. And so we're hopeful that probably when we meet Friday, we'll figure out exactly when we're going to do our long-term recovery kickoff meeting. And at that meeting, we'll do nominations for the positions, and hopefully we'll form that group, and then we'll figure out what the next steps are, because I think a lot of people that we're seeing in the community are past that initial, still struggling, I think, and it shows in your numbers with the basic needs. You know, the food number I think that you shared with us was, I was like, wow, because it's gone up increasingly. So I think people are still struggling with their basic needs, obviously rent and being displaced. And so we just really need people in the community to gather around, volunteer, and be a part of that solution.
Thank you.
Anybody to come online?
Yeah, we have to, Kenya? She said it's slow. Kenya, if you'd like to introduce yourself and your organization with any updates as well. Christina?
Hello, can you hear me?
Yes.
Okay, very good. Hi, guys. I'm sorry I pulled over. Thank you so much for the opportunity. I'm Christina Arnold. I am City Councilor for Ward 1, and I appreciate the opportunity to have a moment. Thank you, Ms. Carey. Anything I can do regarding the flood to assist you guys, please reach out to me. I think collaboration is what's going to get us through this, so anything I can do for that, I'm always available. One of the things I wanted to mention today, just to take a couple minutes, I'm on the Public Safety Committee, and we are currently working on creating a crisis intervention team. Over the last 2.5 years, I've been really studying, researching jail diversion in our community with Commissioner Dara Dana. And an aspect of that is a crisis intervention team for Roswell. And getting that set up within the city is, it's going to be kind of like going uphill in an avalanche because, some of our counselors with their concerns on funding and other aspects of just implementing that. I do want to stress that our community is in a peril because we have a mental health crisis, and it's happening on the street with our homeless and our just our general population. And the current policy of the city administration, city council, and police administration, I don't think is properly handling when they come in contact with the mental health community. And so this crisis intervention team is made up of a police officer, a paramedic, and a clinical social worker. I'm coming to you today to let you know that we are giving updates. It's an action item on the Public Safety Committee, and the presentation will be in February. But I need support from the health community, the mental health community, and I need professional support in conveying to the other counselors the benefit of a team like this. This team would be organized to not only handle mental health calls, not only handle suicide calls, domestic violence, but also be available to respond in emergency situations such as the flood. Because imagine having a team of people that would have been out on the streets and still be able to react or respond to people having crisis due to the flood. So this team has a very broad reach, but I need some support from the mental health specialists in our community, and I just wanted to put that out there. So to ask people to either contact me or have coffee with me or whatever I can do to kind of let you know what we're building, and also any advice or suggestions that you have as we're building it, but also letters of support, anything like that we can do to convey to the other members of the council and the administration on the importance of a team like this when it comes to supporting the civil rights of the homeless and the mental health, the people in mental health crisis. And if you have any questions, I'll stand for those or anything like that. So that's basically, I just was coming to ask you guys to reach out to me or let me know who I should reach out to so we can get that support.
So years ago, Christine, we had a very significant crisis intervention team along with a correlation with the courts and with the domestic violence, et cetera. And there's a lot of narrative and a lot of paperwork. The one that would still have some of that in binders, so you don't have to recreate the wheel, would be what is now CASA, like CASA Behavioral Health, because that was counseling. So had very, very significant, very experienced teams that went into schools and a narrative and bylaws, et cetera. And they may still have some of that narrative in binders that might be able to help you as you move forward.
Okay, thank you so much. Elizabeth Macias, she was the initial part of our subcommittee, not this public safety committee. So I'll definitely reach out. We have been in contact with her, and if she has, the program, because this is to get an ordinance to actually create a crisis intervention division that's part of the city not part of the police department, not part of the fire department, but an entity within itself, hopefully funded with opioid funding. And I will actually absolutely reach out to her and see if she does have any of that left. Thank you very much.
What day is the meeting?
So this next public safety meeting is January 21st. It's a Tuesday, I believe, at 4 o'clock at City Hall.
City Hall, large conference room.
Yeah.
What
And you
time is
said
that?
2 o'clock? 4 o'clock?
4 o'clock. Yes. January 21st, that Tuesday, at 4 o'clock.
Can you put your contact information in the chat, please?
Yeah, I can try to figure out how to do that. Yes, I'll be happy to. I'm technically not savvy, but I will actually work on it.
Do you want people to have your cell phone, Christina?
Oh, absolutely. I put it out on Facebook. Yeah, I put it everywhere.
Her number is 505-353-6669.
Thank you. Yes.
Thank you.
Thank you, guys.
Thank you.
Anybody else?
Did I miss anybody?
Kenya's hands up.
Kenya? No, it's mine. Michelle put it's her birthday in there. Happy birthday, Michelle.
Thank you.
Now I'm gonna do the.
Okay, while she's doing. I did forget to mention before you guys jump offline. We have started putting out the survey for the resource list to be updated. So that's our information for 211. So in order to provide information to the community, we need the community members to give us information. We're doing it different this year. It's going to be through SurveyMonkey. It's really fast. It was a lot to build it. But on your end, you should take maybe 3 minutes, I think, to do it.
It took me like 30 minutes yesterday.
30 minutes, why?
It had over 100 questions. Ooh, I don't know what I did wrong, but I did something.
And you have to. Okay, you're gonna have to hold off because that should have skipped all those questions.
Yeah, it was supposed to skip some.
Okay.
It was over 100. I'm like, oh my gosh.
Okay, hold off. I will send it out via email again. Because I guess we ended up with a technical glitch.
OCD, and so then I'm like reading through the.
We have also put out information for veteran business owners. So with the Veteran Symposium, we're gonna put a resource guide together just for veterans. And in that, it's also going to include veteran-owned businesses. So if we could get that stuff filled out as well and share it, let everybody know, so that we can get that started. Does anybody else have any other updates? All right, in that case, we're gonna go ahead and go to the drawing.
Did I skip anybody's name by accident?
Yeah. Tiffany, I have your $25 Visa gift card.
Woohoo! Gas. That's my gas money now. Thanks, guys.
And then as we go into closing, the last thing on your agenda is you'll see the meeting dates for the year have already been planned out. So you can update your calendars, make sure you're available to attend. And unless we have anything else, I'll go ahead and call the meeting.
Thank you, everyone.
All right, thanks, guys. We'll see you. The next membership meeting is Wednesday, February 12th. We do have a special board meeting, which all the board will need to be at on Saturday, the 18th. And the next executive board is January 23rd. All right, guys, thanks.
Thank you.
And the special board meeting